Hello everyone, this is Miss Dossett. This video today will demonstrate how to initiate a peripheral IV. I have included a PowerPoint on Blackboard under the lab section that you can follow along with this video that will assist in your skills preparation. I'm not going to list the 12 safety practices, but I will incorporate them within the skill. So we're going to begin with how to prepare for our procedure. The very first thing that we must do before we start any type of IV is to verify the doctor's order. To make sure that we have the correct IV site, the correct type of IV needed, as well as any orders for IV fluids that the doctor would like us to infuse. Once you have verified the order and your solution if need be, then next you want to go ahead and you want to think about your patient. We need to assess what's going on with our patient. Does our patient have any allergies to latex, to tape, betadine, ChloraPrep? Are there any comorbidities that may hinder us with this skill? Has the patient had a mastectomy and is not allowed to have sticks on the left or right side? Has the patient previously had a stroke where they have paralysis to the left or right side? So we want to take that into consideration, and also we want to consider, why is our patient getting this IV? Are they getting it for hydration while they're in the hospital, or is our patient going to need to go home with long-term antibiotics? If that's the case and our doctor has ordered a peripheral IV, we may want to talk with the doctor to see if we can move forward with potentially a PICC line or something, another type of IV that could be used more long-term. And we really need to think about, why is our patient needing this IV? What interventions are they needing? This will help us to decide what size of an IV catheter that we need to use. If the patient has orders for blood, we know that we probably don't want to start an IV with a 24 gauge catheter. And from there, you want to gather your supplies. And in just a moment, I'll go through the supplies specifically. And once you gather the supplies, you will perform hand hygiene before entering the patient's room. You always knock on the patient's door, introduce yourself, and enter into the patient's room. Once you come in, you want to just take a look at your patient, assess their overall well-being. Are they anxious? Are they in any type of distress? Are they comfortable and resting quietly in bed? I like to go ahead and ask my patient which is their dominant hand or which is their dominant side. The reason why I do that is, if possible, I try to avoid that dominant side. If for no other reason than we are more likely to grab for things and do things with our dominant hand, and it will help to reduce the risk of dislodging the IV. Before we start any type of procedure, you always want to identify your patient. My patient today does not have an armband, so we are just going to have to say that it's on the other arm that's missing. So once you identify your patient with two identifiers, which is their name and date of birth, you can proceed. You always want to explain the procedure to the patient and provide for privacy, so shut their door or pull their curtain. And once you've explained the procedure to the patient, you want to give them time to ask questions or express any concerns that they may have in regards to this procedure. I always like to look at my patient to see if they have any medical alert bracelets that their health history may not have alerted me to, such as the mastectomy previously, or if they have dialysis access in one arm or the other. And ask your patient. Your patient most likely will know more than any of their history provided in the chart. And lastly, I like to ask my patients, is there any reason that we cannot start an IV in either of your arms today? So once you've provided the information about the procedure, as well as you've allowed your patient to ask any questions that they may have, get consent from your patient that it is okay that you start this procedure. And once you have consent from your patient, then that's when we can begin setting up our supplies. So I'm just going to hover over the supplies that I have gathered, and we will go through them. Of course, this is my hand hygiene for the day. I have that. I have 2 IV catheters, and I'm using 20 gauge because our patient's getting blood today. I do have an extension tubing. You may hear these called a J-loop, a pigtail, and it all just depends on where you work or where you have worked. I have my saline flush because the doctor ordered it as a saline lock, and that is going to be my medication that I'll put in. Of course, I have my gloves. I have some alcohol prep pads if needed. And last but not least, I have my IV start kit. Most IV start kits, they come with your tourniquet. They have your transparent dressing, also known as a tegaderm. They have gauze, as well as tape and ChlorPrep. Most people use the ChlorPrep within the IV start kit to cleanse the area before starting the IV. And so once you make sure that you have all your supplies, the last thing that I like to get is a towel. This is my table for the day, but over here with my patient, I put a towel underneath their extremity to reduce the risk of making a mess on their bed sheets and with the patient as well, because sometimes starting IVs can get blood everywhere. So once you've gathered your supplies, we're going to go ahead and we're going to begin prepping for the IV. So from here, you need to raise the head of your bed up to work from your waist level. This just helps with body mechanics and goes back to our 12 safety practices. When it comes to setting up your supplies at the patient's bedside, there are a couple of different ways that you can do so. Not one way is better than the other. It's just going to be your preference, what works best for you. Some people like to go ahead and have the majority of their supplies set up at the bedside table before they even begin the procedure with the patient, before they even begin assessing the veins. Other people prefer to go ahead and take a look at the patient's arm, apply the tourniquet, assess for the site that they would like to initiate the IV, then set their supplies up. For me, I have found the best way is kind of a combination of both. So I'm just going to go ahead and demonstrate how to set up the supplies. Of course, if you've touched anything in the patient's room that could potentially be dirty, bed rails, bedside table, go ahead and perform hand hygiene again. When in doubt, it's best to go ahead and just perform hand hygiene. And so what I do to begin is I go ahead and I have my saline flush, which is the medication, the fluids that the doctor ordered. Go ahead and get that out. Now with the saline flush, it has a cap on it. It is sterile currently with that cap on it. If I was to remove the cap and touch it, it would no longer be sterile. So I have my flush. The next thing I'm going to do is I'm going to get my extension tubing, which, like I said previously, some people call it a J-loop. Some people call it a pigtail. But this is what will attach to your IV catheter so that you can instill medications and fluids into your patient. And you will notice that there is an end here with a cap that is sterile. That tip is sterile, and this is actually what's going to attach to the IV itself. You have a clamp, and you also have the end that will attach to your IV fluids or your saline lock. Because I touched the end of this, I need to scrub the hub for 30 seconds with my alcohol prep. So we're going to say that 30 seconds has passed. Then I will take my saline flush and I'm going to attach it. And the reason why I'm going ahead and doing this is because when you open your J-loop, there is air in that line. And you have to expel the air. And the way that we do that is we push the saline solution. And you see that dripping through there. And that will expel the air. So we know that now we have primed our line. So what I do is I just set that aside. And I like to go ahead and open my IV start kit. And the reason why is you can't assess the patient unless you have your tourniquet. So from here, I will show you, this is the ChlorPrep that we're going to use to cleanse the patient's skin before insertion. And the way that this one works is it's got butterfly tabs, and you will just squeeze them together. It will pop. And the cleansing solution will moisten your pad here. We also have our tourniquet that we're going to use. Okay. And then we have tape, and I'm going to show you guys how to set the tape up in just a moment. And this kit actually comes with a pair of gloves if needed, but I have my own. And then you have your tegaderm. This will go over your IV site to keep it covered to reduce the risk of infection. Now tape, I'm also going to show you guys, there are a couple different ways to tape an IV. What I like to do is, on my bedside table, I like to take just a piece of tape, and I like to just put it down on the bedside table. And once I've done that, then I will take pieces of tape that I'm actually going to use and let it stick to that sterile piece of tape. The reason why I do this and let it hang off the edge of the bedside table is because if we stick tape directly to the bedside table or we stick tape directly to the patient's bed, can we guarantee how clean that is? We cannot. So this just helps reduce the risk of transferring bacteria to the patient. Okay, and I have my IV catheter, and I'm just going to leave that there for now. And what we're going to do is we have to assess our patient now to see what would be the best location for the IV. Okay, you're going to see me. I'm going to move the camera just a little bit. Just bear with me. Okay, you can see my arm. So what I'm going to do is, once again, I'm going to perform hand hygiene before I touch my patient. And you're going to see IV started many different ways. You're going to see some nurses that use gloves for everything. You're going to see some nurses that don't use gloves for any of the procedure. So just remember that you want to keep yourself safe. And so the best practice is just standard precautions, so you can put your gloves on. And I like to talk to my patient the entire time I'm doing this, and the reason why I do that is just to let them know what's going on, and I'll always express to them if they have any concerns or questions to let me know. So Mr. Jones, I'm going to go ahead and I'm going to apply this tourniquet to your arm. It's going to get a little tight, and we're just going to take a look to see if we can find a good site. So your tourniquet, turn. And tying a tourniquet is a skill all in itself that will need to be practiced. So once you have that tourniquet tight, then you can start taking a look at your patient. If you need them to make a fist, open and close it, or if you need to dangle their arm off to the side of the bed just to get that dependent angle, or a warm blanket sometimes can help to dilate the vessels so that you can better see. And so what I'm going to do is I'm just going to take a look and feel to see if I can see anything or if I can feel anything. And so for Mr. Jones, it looks like right here looks like it's going to be the best location for my IV. So once I've decided on the location, I'm going to set the phone back down. This is a very important step. You want to make sure to release this tourniquet. That is for patient comfort and for patient safety as well. You do not want to keep a tourniquet on a patient longer than necessary, so you've got to make sure to release that. If you have a patient who has very fragile skin, you can use either a washcloth as a barrier to tie the tourniquet, or I like to pull the patient's sleeve on their gown down, and I put my tourniquet on top of that sleeve to reduce the risk of pinching their skin and causing skin breakdown and an open area. So once you have identified your vessel that you would like to initiate your IV in, from there we want to go ahead and we're going to finish getting our supplies ready so that we can go ahead and get this IV started. Now that we have prepared all of our supplies and we have decided on the IV site that we would like to initiate, we're going to go ahead and get started with the procedure. What I like to do before I reapply the tourniquet is my extension tubing set. I like to go ahead and loosen this sterile cap just a little bit. I don't take it all the way off, and this is just going to make it easier once you have to attach it to your IV cannula. And I go ahead and I will open my IV catheter. I want to have everything ready to go as soon as I'm ready. And throughout the whole procedure, I am inspecting all of my packaging, making sure that it is not expired. There are no breaks in the packaging and the seal to make sure that everything that we're using is up to date and brand new with no defects. So what I like to do is I'm going to take my ChlorPrep. I'm going to activate it by pushing the butterfly wings together, and I want to scrub my patient's skin for 30 seconds. I want to start at the insertion site that I plan to go, and I am going to go into a circular motion and work my way out, and I'm going to scrub for 30 seconds. And once that 30 seconds is done, I'm going to let the area air dry. You do not want to waft it like this. You want to let it air dry. And while it's air drying, you can go ahead and reapply your tourniquet and remind your patient that it's going to be a little snug. Okay, we want to go ahead and get our IV catheter. I like to have all of my supplies within reach. I've got my J-loop. So my IV cannula, as you can see, there is the actual needle itself. Then you have the plastic catheter, and I will slide this out so that you can see it. This is what is actually going to go into the patient. And you also have this push tab that you're going to use to release the IV catheter from the needle stylet itself. So what I like to do is I take my non-dominant hand and I hold the skin taut so that it doesn't move during insertion. You want to go at about a 10 to 15 degree angle. So 10 to 15 degree angle for your needle from the skin. Always let your patient know what you're doing, because if you stick them without preparing them, they may jerk and pull the IV out of their arm, and then you have to start all over. So Mr. Jones, there's going to be a big stick, and so you want to puncture the skin and advance, and you will want to notice a flashback, a blood return. You may see it in the plastic portion of your catheter, but you should see it in the chamber here. So when you have that flashback, this is when we want to use the push tab, and we want to separate the actual needle from the plastic cannula, and you want to push back, and you will want to pull this back until you hear the click. And I'm going to be quiet so you can hear the click. That click lets you know that your safety mechanism has been activated to reduce the risk of a needle stick. You must activate your safety mechanism. So once you've activated the safety mechanism, the next important step is release this tourniquet. Remember, activate your safety mechanism, release the tourniquet. So from here, you can take a breath. The hardest part is over, and what you want to do now is you've got to attach your extension tubing with your saline. So what I like to do is I like to take my 5th, 4th, and 3rd fingers on my non-dominant hand, or just the last 2 fingers, and you want to hold down and compress the vein above the insertion site. You are going to have to hold with your first 2 fingers the actual IV cannula, and you're going to have to twist the needle stylet off. Set that to the side, and this is where loosening that cap comes into play, because you're able to just pop that cap off. You want to attach it to your IV catheter and twist it, make sure it's tight. And from here, I always tell my patients, hold really still. We're almost done, but we need to tape everything. So what I like to do is I like to keep a hand at all times on the needle until it's taped down. And now we'll need to assess for blood return. So what you do is you take your syringe, you pull back on the plunger, and we expect to see blood come into our tubing. And once you've seen that, you have assessed for blood. So now we have to instill the saline per doctor's order, and you will push in the saline at a smooth rate, nice, slow, and controlled. And once that's in, you can lock your line. And here comes that tape that we prepared earlier. So there's 2 different ways to tape that I'm going to show you today. So one way is you just take a piece of your tape and you just put it right over, and then we'll finish. Now I'm going to take this tape off because I'm going to show you another method, and it's called the chevron method. The chevron method, what you do is you take your tape, sticky side up, and you bring it under your extension tubing all the way up to the insertion site, and you fold it over, the tabs over. And that's called the chevron method. And like I said, whichever method works best for you, that it's not a problem either way. So once you have that tape and you have the site secured to the skin, you want to go ahead and apply your Tegaderm. And as you can see previously, I have put the date, the time, and my initials so that anybody that may assess this site knows when and who performed the skill. So you will remove the back cover of your Tegaderm. You'll place it directly over your site. Okay, and then you'll remove the rest of the protective covering. Nice and slow. Now this is where your sticker is that gives you credit for your procedure. So you just need to apply that. Now we have this extension tubing just sitting here. So what I like to do is I like to secure that extension tubing to the patient's arm so that it's not flopping and reduce that risk of it dislodging. So I like to just bring it up and I secure a piece of tape. Okay, once you have that tape secured, you want to always assess your patient. You want to make sure that they are not in any unusual pain. You want to go ahead and reassess your IV site. Is there any redness, any swelling? Is the patient reporting discomfort, burning? From there, if they are not, then one of the most important things that we need to do, we need to educate our patient. We need to educate our patient on the signs and symptoms that they need to let us know if it occurs, such as the redness, swelling, pain, if they notice tingling, or if the patient just feels like something's not quite right. Let them know to tell us so that we can assess that site. Also, you want to talk to your patient about avoiding getting this area wet. And of course, make sure the collate's within reach so that if they need assistance to the bathroom to get out of bed, we can come help them so that they don't get tangled in their IV tubing. And once the procedure is finished, you want to return the bed to the lowest position for patient safety, and you want to discard all of your supplies in the correct disposable containers. Of course, the most important thing is you want to make sure that you put your sharps, your needle, in the sharps box. That's very important. And the rest of the supplies should be able to go into the trash. You want to go ahead and remove your gloves. As always, perform hand hygiene again before leaving the patient. And then we have to document our procedure. So once you've sat down at the computer and you're going to document, there are several things that you need to document. You need to document which vein was selected for the IV, how many attempts did it take to start the IV, what size IV catheter did we use for this procedure. You want to note the blood return and that the IV was patent. Also, you want to note how your patient tolerated the procedure. Were they screaming and crying? Were they content? And also give yourself credit for the education you provide for your patient and their family. Go ahead and chart that you taught your patient about the signs and symptoms to report with their IV. And again, you want to make sure that you chart your IV dressing assessment. Is the dressing clean? Is it dry? Is it intact? And from there, you have successfully started your peripheral IV. After you've done this, then comes the assessing. We want to assess our IV site and the IV fluids and rate that is running every hour. We want to make sure that we are going into the patient's room. We are actually looking at the IV site, at the skin around it. Check your tubing. You also want to check the rate of any fluids that may be running on a pump to make sure it's correct and hasn't been changed without your knowledge. Just getting your eyes on your patient and talking to your patient does wonders, and it makes the nursing process much smoother. And that concludes our IV start.